So if you could just start by introducing yourself in chat, sharing your name, role, organization. There are some new folks here. Actually, since we're a small group, do you also want to just quickly go around the room? We have a few new folks from Cypress Hills joining us today, and I think let me stop sharing the screen so we can all see each other. I'm Carrie Fallhaber, Vice President, Jobs First NYC, and I will pass it to Jonathan. Oh, Jonathan, you're muted.
Hi, everyone. Sorry, my name is John Gabe. I work with St. Nick's Alliance as the Deputy Director of Skills Training. Our programs tend to center on tech and construction and also healthcare.
Wonderful. You want to popcorn it to somebody else in the group?
Sure. I'm passing it to Salma.
I felt that coming. My name is Salma. I am the Senior Job Developer here at Cypress Hills. So I work with all of our programs participants. Was that all? Or do I? Oh, popcorn it. Dave.
Thank you. Dave Scott, Manager of Work Solutions at Jobs First NYC. I will popcorn over to Megan.
Thanks, Dave. Hi, everybody. I'm Megan Marshall. I'm the Associate of Work Solutions at Jobs First NYC. And I'm super proud to be here today and for what we're going to do today. Nice to see you all. And I will pass it to Nicole.
Thanks, Megan. I expected that too. Nice to see you. Nicole Sanchez, Assistant Director of Career and Education Programs here at Cypress Hills LDC. So our sector-based programs include the same as Jonathan's, healthcare, tech. We also have construction and transportation, and we also have a train and earn program as well. I'm going to popcorn it over to Daniel.
Good morning. I'm Daniel Augusto, Director of Workforce Programs with Phipps Neighborhoods. And our signature program is our Career Network Healthcare Program. I will popcorn it to Stephanie. Stephanie, did you go yet? No.
No, not yet. Well, good morning, everyone. My name is Stephanie Aviles, and I work with Cypress Hills. I am the Director for Careers That Care Program. So we enroll students in phlebotomy, EKG, CNA, and I'm happy to be here as well. I'm going to popcorn it over to Amy.
Hi, good morning, everyone. I'm Amy Robbins. I'm the Director of Advocacy for PHI. We are a New York-based national organization that is focused on improving the direct care workforce, so home health aides, CNAs, PCAs, all of those frontline healthcare occupations. And I think, Dwayne, you're the last one.
Yep, I think so. Good morning, everybody. Dwayne Brown, Deputy Executive Director for Workforce and Education for Phipps Neighborhoods. We do all the great things that Daniel mentioned. And so I'm excited to be here and looking forward to figuring out how we can partner with all the great organizations in the room.
Thank you, everyone. And it's good to see you. Cypress Hills, many of you, I'm sure, familiar with their work, and Jobs First work with them very closely in our young adult sectoral employment project and some other projects. And they reached out and we were talking about healthcare related work, and they were like, how do we get involved? So I said, just come. And we can organically and intentionally grow our network in this way with people who are doing good work in healthcare. And also with some of the folks, we'll bring back up later some things that were mentioned in feedback forms of we should talk to this group or that group. We'll ask for your advice and potentially introductions to some of those folks. So quickly, just to recap for the new folks, we have been coming together. We had an early meeting in March just to talk about what, why should we, and if we should do this. And the resounding response was yes. And so we are coming together. We've been looking at all sorts of data, going through the Jobs First partnership development process, which includes the 5 I's. Oh gosh, I don't have them in front of me, but Dave will go over them later. The first one is investigate, though, and the next one is imagine. So those are the 2 areas we've been in kind of for the past few meetings. And investigate includes looking at lots of data and information, labor market data, your on the ground knowledge, and imagine is really what we're doing now. Investigating never stops, but imagine is kind of us thinking about how do we solve for the barriers, how do we work together, what can we do as a network that's different than we do in our individual organizations that could make workforce development in specific to this group. In healthcare, it could be any sector, but in healthcare more powerful. How do we have a voice in advocacy and policy together to make sure that there are legislative supports for good and best practice, and things like that. We'll talk about the collective agenda in a minute, but let me share my screen. Sorry, doing two things at once. So norms, we go over these every time. I think, you know, you've all been joining lots of meetings, our network. I would say the most important thing is that we love to see your face. Ask you to keep your camera on if you can, because it's a small group and it helps us collaborate. And I think the other most important thing is we really welcome honest feedback, lots of feedback. Come off mute if you want to, raise your hand if you want to. It just makes the network better. And you can, if you could right now just use any available Zoom reaction to know, so I know you're on board with the norms, you're hearing me, and that this is a safe space. We'll keep it a safe space. Thank you. Appreciate that. And let's see. So we're going to just do a real quick, like 5-6 minutes. There's not many of us, so we'll just pair off in groups of 2 and chat. Just to hear, thinking about, you know, September is a crazy time for us in workforce development, and in pairs of 2 or maybe 3, depending upon how many are in the room here. If you could share any success story, a strategy, something you're excited about as September programming rolls out, and maybe one thing that's keeping you up at night, and you could choose one or the other if you prefer. You don't have to do both. And let me stop sharing my screen, and Megan, if you could send us away into conversation.
I was on mute. I'm setting it up now and you should see it shortly. Here we go.
So one of us should join Stephanie. Oh, you moved Stephanie. Okay, great.
Yeah, it was like not letting me create the rooms how I had.
If there's a single person, you could always stick me in there. I'm happy to talk to someone, but better for them to talk to each other for sure. Okay, so looking at the clock, 10, let's say it was 10:11 or 10:12 when they went in.
10:12, yeah, because I just moved Stephanie late.
Okay, so let's say till 10:17, since it's 5 minutes, good for 2 people to chat.
Yeah, I think that's more than enough time.
And does that keep us on track timing?
Yeah, we're doing pretty good.
Okay. And anyone receive emails from folks who haven't showed up?
I have not,
Dave?
not that I see.
I have not.
Let's see if I have.
Oh, Carrie, if they're coming back at 10:17, we have slated to go to my section at 10:21, so just heads
Okay.
up.
Good. I didn't cover lots of things, so I will.
I think that's pretty.
Dave, can you copy and send out again, just in case people are wondering? I don't know if they see in the breakout rooms what's in chat. You could do it like a breakout room blast.
Sure.
Broadcast or whatever it's called. Thank you. All right, let me check my email inbox. No.
Also, my cursor is now doing weird things when I try to switch between the two screens.
Yep, I have that issue too.
So if I start having cursor trouble, I'll just say it out loud. I'm nervous.
Don't be nervous. It's a very nice, friendly group.
I always get nervous.
I do too. What helps you be not nervous?
Preparation. I would be way more nervous if I didn't feel prepared. And deep breaths.
Wow, my seltzer matches my shirt.
You
Like
planned it.
exactly.
Oh, Carrie, Marjorie brought me breakfast today.
That's wonderful.
I was like, what the heck? Thank you. So nice.
Well, that's because you bought snacks yesterday. Was it nice? Was it good?
It was from Pret. I was telling Dave, I think since I ran late because of the train this morning, I think she had bought it, and it was in the cardboard and the tortilla was probably hot. And so then it got cold and stuck to the cardboard a little bit.
Yeah. I'm
So
just
I didn't finish all of it, but the part I had was good.
good. Okay, what's next? Objectives. Oh, I'm in the wrong section of the annotated agenda. Get back. Okay. So if it's one more minute, should we call them back and give them 60 seconds or wait?
I think we can wait.
Wait till 17 and then end it?
Yeah.
Felt fast. All right, I will close all rooms.
Sounds good.
That's good, they're talking.
That's a good sign.
Mhm. Sometimes people accidentally come right back or purposely.
Yeah.
Oh, wait, I don't want to have the screen up yet because we're going to ask them to share what they heard. Hello. Folks will be coming back in a few more seconds. All right, welcome back to the main room. Anyone want to share something they heard that was interesting or they learned or they were in alignment on? Is everyone being kept up at night by the same thing?
Well, I'll share. I had the pleasure of working with Nicole and talking and conversing with Nicole. And the things that she mentioned was, preparation for our students and participants around tape testing and the barriers that educational requirements kind of presents for our participants. Because if they're not prepared and they're not at a certain level, it's an indicator that they may not they're probably not going to pass the certificate, the test for the certification. So I think that's something that Daniel and I talk about as well, not only with our healthcare program, but with some other programs that we're about to launch as well.
Thank you, Dwayne, Nicole. Yeah, that's a common challenge with the tape, of course. Anything else? Anyone excited about something you want to share? More stress than excitement?
Well, John from St. Nick's, I shared with Daniel and also Stephanie that I'm excited that we have 4 different programs that I manage with skills training, and we have managers for each of those programs. So I'm really excited that there's additional support in each.
Nice. That's great.
I can share. Salma and I talked. I think one of the things that she said that struck me is just like clarifying what I'm seeing in the world right now is that her trainees are being very picky about the jobs that they want to take, the employers that they want to work for, and the specific occupations that they want. And it just like, of course, like we're all seeing that right across the board. But it's interesting to hear that articulated at the training level. And the other thing that's keeping us up at night is our cats. So
that's funny. Is there something in the air? Because my dog, who's usually a fantastic sleeper, has been like crawling all over me at night. I don't know what's going on. I haven't slept in 3 days. That's interesting. But yes, what you're saying, Amy, we're hearing across the board, not just around clients being pickier or trainees being pickier about where they work, but all of our workforce partners having a really hard time filling open positions. So certainly been reading a lot about that and more to unpack there. Well, thank you all for sharing. I'm going to quickly go through some things so I could turn it over to Megan. Let me share my screen so we could just review today's objectives. So you can see them on the screen, obviously. We will be identifying opportunities and key existing resources toward greater coordination and collaboration, sharing and discovering relevant updates and highlights with one another, and affirming the partnership development process, its value for building a healthcare sector network and forging ahead. And today we will be successful if we continue to share openly, affirm the things we agree and can address together, and agree on a process to make that happen. And quick reflection, in the previous meetings, you all, the group that's been coming together, have identified that together as a network, we can consider improving entry-level jobs, complement each other's training, services, curriculum, etc., and make cross-network referrals, partner for career pathways, considering an advancement strategy, design and launch a marketing campaign, share best practices to connect with better quality jobs and employers, and develop a policy agenda. We're aspirational and we're working towards these things. And in our last session, we looked at real-time labor market information in New York City's healthcare sector. If anyone wasn't there and didn't get a copy of that data, we're happy to reshare it with you. And we defined barriers and started to identify opportunities for greater coordination and collaboration, and continue to build momentum on the partnership development process for building a healthcare sector network. If in anything I just laid out, I know I went through it quickly. If you have questions, feel free to come off mute, or if you're more comfortable putting them in chat, I'm happy to address or share via email anything from the prior meetings. There's been a lot of really good data data presentations and conversations. Let me just pause, make sure I am not seeing everyone's faces because I have my screen up. Okay, looks like folks are ready to move on. And I will pass to Megan.
Thank you, Carrie. I appreciate it. So as we begin to turn our efforts towards mapping our network assets and this investigative phase that we're moving into, the imagine phase that Carrie was talking about before, as we were preparing for this session, we decided to pull some information gathered from the Good Job Challenge questionnaires you all filled out and plugged it into the barriers and solutions document that we worked on last session. For those of you who weren't here during that last session, the group had kind of a brainstorming session around some of the barriers our participants face in our programs and how we could potentially solve for them and what those opportunities might look like. So we wanted to take some time to kind of review, reflect, ask questions to inform how we move forward. And this information will set us up for network asset mapping, which is to come, also affirming some of our priorities and all that good stuff. So in this portion of our agenda, we'll again revisit those barriers, review and brainstorm any additional opportunities or strategies to solve for those barriers, and then we'll have a little voting activity around that as well. Dave put the link to the participant agenda in the chat. Thank you, Carrie. And Carrie has it on her screen. So if you open that and you scroll down to where you see barriers and how this partnership can solve for them, that's kind of where we're going to be doing our thing. Can I just get a thumbs up when you guys are all in that area? Thank you. I see one. And now I'm having some problems with on my end, sorry.
Megan, if it's helpful, I could keep it on the screen here if that's easier for you to view it that way.
Yeah, that might be helpful to me just as backup. I'm using two screens, so sometimes my cursor between the two gets a little wonky. So thanks, everybody. Okay, so it seems like we have pretty much everybody there in the section. Is there anybody having trouble accessing it? Okay. All right, so first I would like for us to kind of visit the barrier sections. And as you'll see, there is black text and there's purple text. So the black text reflects what we worked on or contributed as a group in our last live session. And the purple text reflects and kind of summarizes a lot of different additional answers we pulled from your Good Jobs Challenge questionnaires and responses. So I wanted to look at those, kind of revisit them, read them out loud, and just affirm that they still apply. And if there's anything additional you feel we need to add, we can do that. Can I have a volunteer to read out the section that says client attributes under barriers?
Sure, I can go ahead.
Thank you.
So the client attributes, employment history, skills, language, and backgrounds, etc. So we're considering the fact that some participants are not vaccinated or not willing to get vaccinated. Also, we have to consider their immigration status, the fact that they don't have a high school equivalency, TABE levels for math and reading, little to no English, low literacy levels, the ability to pass a drug screening, never held formal employment or unemployed upon enrollment, financially unstable, and personal fears around COVID-19, in addition to mental and physical health challenges, history of substance misuse, involvement in the criminal justice system, and they may or may not be pregnant or parenting.
Thank you. So just looking at those, now that we have the two buckets of information pulled together there, is there anything missing that you guys want to add? Feel free to come off mute. You can also type it in there if you want. And if you don't want to add anything, do we affirm that this list looks correct? That these are a lot of the barriers our participants face? Can I get an off mute yes or a yes in the chat or a no? I want to make sure we're all good on the same page.
I think it looks about right.
Copy what Salma said. It looks good.
Perfect. All right, so I want to move to the next one and then we'll ask some more generalized questions about the barriers. Can I have yet another volunteer to read through the external factors under the barrier section there, please?
Sure, I volunteered.
Thank you.
External factors, systemic barriers, housing, childcare, etc. Specific to job seekers, can't afford to be in training without stipend, cost of transportation, lack of childcare/family care, lack of mental health support, high degree of housing related issues, cost, debt, unhoused, lack of Wi-Fi device access, can't afford, find appropriate work attire, food insecurity, poor health coverage, non-living wages for entry jobs in healthcare, specific to training orgs, a lack of physical space to train more people, difficulty finding strong clinical social workers or case management challenges, lack of funding for more wraparound service supports, lack of funding to provide training stipends, lack of funding in general, systemic, poor job quality and low starting wages, inequitable education structures, criminalization of communities of color.
Thank you. So I'm going to ask the same questions here. If does it look like there's anything in this list that is missing that we haven't discussed or considered? I know there's some new people in the group, so I want to make space to add any additions if we need. Then it sounds like perhaps we may affirm that this list looks correct. Can I get 2 people to say yes?
Yes.
Yes.
Yeah.
Thank you. I got 3 people to say yes. All right, so looking at these barriers that our participants face and our communities face, what are some things that pop out to you? Before we move to the opportunities, I'd like to kind of reflect generally to see if anybody has any thoughts on, what are the most common ones that we're seeing? Have you had any success addressing some of these barriers? I know some of you have been talking about that a little bit. And if you haven't had success, what do you need? What is an opportunity that you hope for that could help you solve some of these barriers? We answered some of these questions below.
Ultimately, I think the funding one is the biggest issue, right? A lot of times we're not able to support our participants the best way because of lack of funding, either for staff or for like stipends and incentives for them. I think one way we try to circumvent that at Cypress Hills is for participants to go through our train and earn program first and use like a pathway to get into careers that care. Because with train and earn, there is potential for some, stipend incentives that's already built into the funding of that program. There's also an internship opportunity that's paid. So at least they can get some money before they start their advanced training. So that's kind of how we've been trying to circumvent that issue. But if we can get standalone stipend or incentive funding for the healthcare training, I think that would be more of an incentive and more realistic, because some of our participants have to work at the same time as they're trying to study for these healthcare positions. And that work time obviously takes away from their study time and their ability to pass certification exams.
Right, and that's a really challenging position to be in. Train for your future, work for your present. And, I agree. It sounds like a lot of having that funding that you just talked about that's like standalone could really open a lot of doors. And I think that's something that this group could, strategize around what that looks like for us as a network and how we can help each other kind of move that forward. Carrie, did you have something you wanted to add?
Yeah, I just was noting to Megan offline while you all were looking through this, that some of you in the meeting here might not know that your organizations filled in questionnaires related to the Good Jobs Challenge proposal, which was a Department of Labor funding stream that Jobs First organized for 3 sector networks, this healthcare one, a green economy network, and a tech sector network. So that as Megan was referencing that, I just wanted to make sure you knew what she was referencing. These things that you see in purple on the list here, Megan and Dave scanned through your responses, your agency's responses to those questionnaires, because we had some overlap in questions here, and pulled out things that you already or someone on your team identified as barriers, as opportunities, and all that. So we're kind of just resurfacing those. That was back in December, January, that they were filled in, making sure they still feel accurate, making sure it covers everything, and making sure you know what your agency shared with us. So I just wanted to get everyone on the same page around that. Thanks, Megan.
Thank you. The Good Jobs Challenge was before my time, so I wasn't sure if everybody knew because I'm new to the Jobs First team. So I appreciate that. And thank you, Nicole, for your input. Does anybody have anything they want to reflect on, add, or contribute to the barriers conversation before we look to opportunities?
I think the only thing, it might not be directly relevant to this, but I would just offer that we're thinking a lot about how to assess the impact of the care infrastructure on people's ability and decision to return to work or, seek employment. And I see that as both a childcare impact and an elder care, people with disability care impact, where I think there are a lot of people who are taking on caregiving responsibilities that they might not have had prior to COVID, that is preventing them from being able to pursue employment outside the home. And I don't know if I'm just curious, I think, if that comes up, if that's something that's this more kind of systemic thing that you guys are seeing in some of your training programs. We're really trying to get a handle on how much of people's decisions not to go back to work are related to that. So I just throw that out there.
I would just quickly jump in, Amy. I don't disagree with anything that anybody said. I think you raise a valid point. I would add on to that, right? And I tend to be very just real and direct. I think just through COVID overall, like in general, people being home for so long and returning to work, while it does have a factor with childcare and other things, I think people just got complacent. They just got freaking just comfortable being at home. So I heard, it mentioned before about, not wanting or types of jobs or what it pays or different things like that. And, I don't think it's exclusive to a young adult population. I really truly believe, even though we operate a young adult program, that it's just it's the workforce in general. I feel like, throughout this time of COVID, like in different, external factors, whether it be people just getting stimulus checks and living off of the unemployment for the amount of time that they did, people just got into a lull of complacency. I don't know any other term to kind of use for it really, but I think they just got kind of comfortable and they're just like, well, I've been at home sitting back, and if I don't feel like, having to go out and do a job, like if there's something I could do virtually or sit back, and you add in the factors, like you mentioned, maybe about, childcare. I don't have those childcare options anymore. The childcare is closed down. They're not taking as many kids. And we haven't even got into the whole vaccination status, which one would presume at this point shouldn't be an issue. But, I know that it's still, it still does come up, for certain things. Our partners require because they have to go through the volunteer services department for their internship, that they have to be vaccinated. And definitely coming off of SYEP, I know that was still a real issue. People were just not completely vaccinated or unwilling to be vaccinated. So I think, those are some additional, kind of external factors. Some of them, I don't know, you want to consider them systemic related, I guess, more than anything else, and maybe specific to all of our organizations. But those are just a few other things that I know, have come up and have had a larger impact than we had intended it for it to be.
Yeah, I want to add on to that. Like Daniel mentioned, like the workforce has changed since the pandemic hit. So I think we haven't, as a labor department workforce, we haven't really moved into that change, or it's not as real for us, especially for employers. A lot of things became virtual. We saw that a lot of different roles can be virtual, and job seekers see that, participants see that. So I think there's a lack of understanding from employers where they are not promoting these roles more, or they're not really adjusting to what the job seekers are looking for at the moment. That's just how I feel.
Yeah, it sounds like there's this whole move that we've all witnessed and been a part of is applying to every sector, but in the healthcare sector, it's like, what does that look like for us? What does that look like for the employers? What does that look like for trainers, job seekers? And how do we adapt? Should we adapt? What does that look like? Who should do the most adapting? All that stuff is something that I think we could talk about and dive into. Does anybody else have anything to add?
I was just gonna say, it feels so timely, right, for us to be pushing with the things you're saying and the questions, because at the same time that there's this struggle to find talent, we're hearing, about the demand in healthcare, right? That it's increasing. It's so high in New York City, in California. I can't remember now. I read it a while ago, but it was like an astronomical number of what's needed just this year, like 500,000 people. I don't know. I don't know if that's the right number, Dave, if chime in. But the demand in healthcare is just, it's gone up post-COVID. It's gotten harder to recruit people into this sector because of all the things you're mentioning, and, just fear, and also feeling what we've heard in healthcare is similar to hospitality. I think, like, feeling like the rug got pulled out from under you during COVID, and you weren't supported in the way that maybe you had some assumptions your employer would support you in times of crisis. And, so what does that mean? And how, why I say it feels so timely. And when we look at opportunities, it feels like there is great opportunity, because if there's so much demand and there's such a hard time finding talent, that feels like the time to really push on advocacy and policy sorts of things, right? And conversations with employers to say, hey, like, some changes have to be made, or we're just going to continue to struggle to match and attract talent.
Thank you, Carrie. I think this conversation is a good segue into some of the opportunities and potential brainstorming and thoughts around how we might solve for some of these barriers we just read out loud and discussed. Thank you to my volunteers. I'm going to ask for, you guessed it, yet another volunteer, please, to read the opportunities section here out loud for us. This one's fairly short.
I can go ahead. Opportunities, new funding, new legislation, collective policy recommendations, local solutions, etc. Offering services within our own agencies, cross agencies, partnerships with a food bank, mental health provider, etc. More funding support for training stipends and internships, state money through CMS to support HC training, particularly home health aides, Rutgers, managing a grant to fund training, initiate partnerships with VOTEC schools, and offer advanced training, policy agenda and awareness campaign, advocacy and support from the city and Albany to serve the low to moderate income community, incentivize employers, and obtaining stronger 1199 support.
Thank you for reading that out loud. I want to point out that bullet point there was, I left it in there because it was part of our conversation. Amy had mentioned it during our last session when we were brainstorming. So I wanted to put that in there in case you wanted to tap into that or talk about that more. But I'll ask the same questions here. These are some of the opportunities we've looked at to solve some of the barriers that we were just addressing. Does anybody have any thoughts around this? Any ideas to add? There's a couple more things below, but I want to give space for people to chime in here too. And if not, we can look at how we can solve for them because these kind of coincide together. Did I cut somebody off? I heard something. Okay, no. This one is long, so if I have a brave volunteer to read this one, I'll take it. If not, I'll read it out loud for us so we can hear it. All right, I'll read through it. All right, so how this network can solve for the barriers. We discussed how and why a network should solve for these issues. So we didn't fully get to this. We kind of touched on it a little bit from last session. So a lot of this is pulled from ideas and suggestions and the Good Jobs Challenge questionnaires, as you see in purple. So we talked about shared resource guide for this group, share potential partners that have been useful, AKA consistent. And then from Good Jobs Challenge, the suggestions offered were strengthening partnerships, creating new pipelines for recruiting, cross-network referral, sharing outcomes data and best practices, obtaining greater support from 1199 for apprenticeships, internships that lead to full-time employment, advocacy, advocate for increased wages and improved health and safety in healthcare, seek funding to offer training stipends. That seems to be a very big theme, among others. Develop pathways for upskilling and advancement to offer our alumni, steer and develop strategies to stack credentials and certifications, build strong or stronger employer partnerships to strengthen the program to job pipeline, collaborative sector and employer engagement, discover ways to get more people through training, build strong wraparound supports to ensure participant success, improve coordination and communication among training providers, leading to better overall outcomes for job seekers, develop and define flexible career paths, systems map, create a directory that includes available workforce development training options, and create common assessments to support participants to be matched to right fit programs. Whew. I read it all, folks. So again, same set of questions. I'd love to hear from you guys about, do these strategies, ideas, potential solutions sound right to you? Is there more we should add? Does something not seem right to you? What do we think about this list? What is possible for us to solve some of our participant barriers together? And if there's no additions, can I get two people to affirm that this looks pretty good? This list looks good?
Yes, it does.
Awesome. Great.
Can I just add, Megan, I think I'm sitting a lot with what Daniel just talked about, right, in the response to the previous section of I think these are all geared around improving job quality. And I guess I'm wondering, is that enough, right? Or are we really tackling the space that we're in right now of bringing people back to work? Is there something that we're not thinking of or including in here that could help get at those challenges? And I would throw that out to the group. I don't have the answer to that. Sort of this, if you build it, they will come, right? If we can improve these jobs, and that we're sort of assuming that people will want to come back and fill the tremendous job gap that we have right now. but maybe we're really talking about a really changed landscape.
Yeah, I would add on to that point, Amy, because I hear you on that. This is a general question. I think we all know and understand like healthcare is what it is, whether we're talking about large institutions and hospitals or we're talking about, smaller healthcare, home care agencies. Is anyone heard of or aware of any changes or trends in healthcare moving towards a more of a hybrid type of work or anything that might involve what we're talking about right now? Because we're talking about job quality and we're also talking about people returning to work, but are there options where they may not need to return to work and that would also create or improve the job quality? And I'm not saying I have the answers. I'm not saying y'all have. This is just a general question. I'm trying to get an understanding from the group what y'all are hearing and based on your your networks and who you're speaking to.
I mean, I don't know the answer to that either, but I feel like for some of the jobs that we're looking for, the roles specifically that we're trying to fill with our participants, I don't see where they would be able to have a remote option, right? These entry-level positions, a lot of them are in person. I think for us, one of the job titles is phlebotomy, and there's some like wiggle room there. It's like if they have a license, right, they can, be a traveling phlebotomist, but then a lot of our phlebotomy students don't have driver's licenses. So there's that, but you know what I mean? But like, I feel like in upper level healthcare, right, there's telehealth options and things like that. But when you're dealing with direct patient care, like CNA, I don't think that there would be a lot of wiggle room there, but that's just my initial reaction. No data supporting that.
No, I get it. So I would add on to that questioning. Does it behoove us to not break it down into allied health versus non-allied health? Because I think it might make a huge difference in what we're talking about right now.
Yeah, that's an interesting consideration of like the subsectors or different ways of working, right? Because when you ask that question, Daniel, about, what's changed in the landscape and what the world of work has changed for so many people, but for far fewer in hospitality and healthcare, except for the jobs that are in healthcare, but we don't always think about first as healthcare jobs, like the medical biller or the administrative role. Even those are probably mostly in person. Not medical biller, but administrative staff I always imagine a hospital setting, but so maybe it's different for a doctor's office. I could actually think about somebody I know personally who in a maybe 8-doctor collaborative office is the office operations person, the medical biller, all of that. When COVID, when people went remote early on in COVID, when it was a big fear and we were all remote or closed, she was remote. However, she was back in the office far sooner than most other people, not full-time, but part-time. And it's their psychiatrists and psychologists. So most of them for a long time kept remote appointments. And while they had remote appointments, she remained remote, would go in once a week to deal with mail or things like that. Now they are mostly back in person, so is she, right? So I think that's just one small instance, a very small office, right? But I think we could probably expand that out to the experience of many people in healthcare. Thinking about other non-traditional workforce development tracks in New York City, like lab technicians and things like that. That's all has to be in person right now.
Might be less relevant to this particular section, but there's also the entire subsector of clinical operations, which can be entirely performed remotely, and for the large part is. less in the business of health care and more in the business of health development though, so it's a little different. But if that's something where people want to be doing health work and absolutely want to be remote no matter what, that is an option.
So for me, what I'm thinking is for direct placement jobs or in-person positions such as, phlebotomist, EKG, things that you have to do in person. If the case is that folks don't want to be doing in-person work, my thought is what needs to happen? Like what can an employer do to get folks to actually want to do this work? What are job seekers or folks who have these positions saying that they need in order to want to remain in these roles and come in person?
Sorry, I'm just writing down what you said.
I think that's a great point, because there certainly are this conversation is sending chills down my spine, right? Because we have a long-term care workforce crisis in our country, and that is in-person, hands-on work. And so, and there's not any way to really care for people who need ADL support remotely, right? And so I think that question of, that obviously I live day in and day out, is how do we improve those jobs so that people want to work in them? But this conversation is really shifting that to really think about okay, we really got to do that even more now, because we're just in a totally different space in terms of what people are expecting from their workplace. And I think that, Salma, your point about employers listening to their workers and really taking into consideration what can they do, right, to make, obviously they need to pay them more, but are there other things that they can do to improve the quality of those jobs in such a way that responds to that worker that would really really wants that flexibility or wants a different kind of work environment. So I just that's a helpful point and reminder that employers have a role to play here too.
Yeah, it sounds like this is a conversation that is, a really big but necessary and needs to happen. And there's a legislative aspect, there's employer buy-in and involvement aspect, there's probably union aspect, there's training, there's so many different players that need to be involved in order to be a part of this. And I think through this network and building our network and strategizing together, that's something we could potentially push forward. I think that we can do something around this. And it sounds like this is such a robust conversation that it sounds like it's maybe something that we need to think about adding onto our list of stuff to tackle. So I made a few comments over there on the side. They're not beautifully written, but I tagged them in there so that we can address them in kind of our next activity. Is there anything anybody else wanted to add? We want to give everybody a quick 5-minute break so we can get up and stretch and re-energize, because I know 2 hours is a very long time for a meeting. So we want to give that opportunity. Does anybody have anything they want to add before we split for 5 minutes?
I did want to mention about the phlebotomist, the mobile phlebotomist, and why participants want to lean towards that. And I think it's the flexibility, even though they don't have their license just yet, being able to be flexible with their schedule is something that they really want. Being able to, say, okay, these are the particular hours I'm going to work, and I have, I'm independent, I'm working independently. I'm not at home, but I'm still able to move around how I please and still get the work done.
Thank you. Yeah, I think that taps into listening to what workers need and want, who's there already that is willing to be in person, and what do they need more of, and how can we leverage that to get more people to be thinking the same way. I think that's great. Anybody else? Okay, so we're going to take a 5-minute break, and then we're going to come back and we're going to do like a quick voting activity around some of this discussion that we had, and then we will talk about where we are in the process, some next steps, and then that will be that. If everybody's ready to keep on plugging along, I'll get us started. Sound good?
Yeah, Megan, let me know, do you want me to share the mural on the screen? Tell me what's most helpful.
Yeah, maybe share it while I talk about it before I give the link. So Dave, please don't drop it yet, so I can kind of explain what they're going to be looking at. Has anybody used Mural before? Okay, so what you see on the screen is thank you, Dave. Something called Mural. It's like an online facilitation software. It's really fun. So I wanted to use this to kind of zero in and rank, if you will, some of the things that we just talked and went through, so we can kind of start to prioritize what we can tackle first, what we would like to tackle first, all those good things, and it'll inform some of our plans for upcoming sessions, the next one and moving on. Like, we need to do network asset mapping, and then eventually we'll create a logic model and all these good things to really, get us launched and activated. And this is kind of step one towards working towards finding clarity around some of the work we're going to do moving forward. So what you see on here is the mural. Right here is the link for the participant agenda. That's just there for reference. If you scroll over to so this is going to be our example voting session that we will do. So I can teach you guys how to vote. You're going to decide what I eat for lunch today. Thank you for the help in advance. And then we're going to do a quick voting session on the opportunities and potential ways to solve for barriers that we just discussed. Does that sound good? And I'll walk us through. So if there's questions, we'll get there. But it's trying to shake things up a bit over here and do a new activity. Sound good?
Yeah.
Awesome. Dave, can you please drop the link in the chat? It's going to ask you to put in an email, and it's going to send you a code. If you could put that code in, please. The email capture helps me log who was using the mural, so I know who needs to still vote. And when you guys are in and you can see the page, just give me a quick thumbs up if you can. Thank you. Thank you. I see some of you at the bottom there.
Is anyone having trouble with the link opening?
I'm not there yet. It's asking me to create an account, and so it's just taking me a minute.
Same, just going to log in with my Google, but it opened up a different browser, so I'm just copying and pasting.
Oh, sorry, everybody. It's making you go through hoops I did not anticipate. I apologize.
If you want to use a different email, I guess it lets you sign up with any email once you get to that page, right? Yeah. I've used Mural before, but I forgot that it made you do that.
Thank you, Jonathan. I got your thumbs up. I see Amy.
Okay, so we got Nicole, Amy, Jonathan. Oh, Someone took the salad. Don't vote yet.
Yeah, I gave you guys editor access, so I'm putting a lot of trust. No, I'm just kidding. So yeah, don't click anything yet. You won't be able to vote yet, but I'll explain how that works. Is there anybody? Who am I still waiting?
People shopping for lunch.
All right, do we have everybody? I think we do. Let me double check. And now my cursor is going crazy.
I see Selma, Amy.
I think we're good.
Nicole. Great. Danielle.
All right, so I'm going to summon all of you to the what should I eat for lunch today? It should pull you there, so we're all in the same spot. So when I start, I'm going to start a voting session. You're each going to get 2 votes. So all you have to do to vote is you'll click on one of these stickies where it says salad, ice cream, pasta, pizza, sushi. You click once and that'll put your vote. If you really feel strongly about one, you can vote twice by clicking more than once, or you can vote on those others. So it shows me how many votes are left, so I'll know when everybody is complete, and then I'll stop the voting
Megan hasn't
session.
opened voting yet. Sorry to interrupt you, Megan. I see we have eager voters.
So I'm ready to start the session, ready to decide and practice the vote. Here we go. So I'm clicking start voting session. 2 sessions. Sorry, it's asking me questions. And oops. Okay. Voting session has started.
Once you click 2, are you done, or do you have to hit enter or anything?
Once you click 2, just stop, and then because I can see how many votes people have left. So once that's finished, I'll close the voting. All right, I think we're about to be done here. I'm going to end the voting session for everybody. Ready? And then you can see what we voted on. So it looks like I am having sushi for lunch. So when we do this for some of the things that we just talked about, you're going to get 5 votes. So again, you can vote more than once if you feel strongly about something. All of the things that we just talked about are important, but what we're trying to do here is prioritize what we want to start working on first as a network and what we want to prioritize. So does the voting make sense to everybody? Did that work successfully? Perfect. So now if it'll let me go.
Is it more confusing for people, me sharing the screen and you looking at your own? I could stop sharing if that's easier. No? Okay.
All right, so I'm going to start another voting session. These stickies, if you can't see them, you can zoom in. That's on the bottom right corner. The one in pink is my attempt to try to encapsulate the very large conversation we were just talking about, about the remote work and the changing atmosphere. So it's not perfect, but that's what that pink one is there. And everything else is what we already read out loud from either the opportunities or ways we can solve for barriers. Any questions before I start the voting session?
And Megan, you said everyone has 5 votes?
Yeah, everyone's going to have five votes, and you can vote on a sticky more than once. So let me do this here. All right, and I'm going to start it. You get 5 votes. You can vote for something more than once if you want to, and the session will start now.
Stop share for a little bit.
And again, I can see how many votes each person is leaving, but the actual votes are anonymous. So when everyone has placed their 5 votes, I will stop the session. Just waiting on a couple more. All righty, looks like everybody's voted. Last call if you want to change any of your votes. Okay, I'm going to stop the session. So. All right, and then here, oh wait, we're not sharing our screen anymore. Can everybody see the results that just popped up on their screens? It should have popped up. So it looks like we had 5 individual votes for building stronger employer partnerships to strengthen the program to job pipeline, which is exciting. So we're going to use, sorry, I just got a message in chat. We're going to use all of these to inform some of our work going forward, but I just want to double check before we move on if anybody feels strongly about needing more votes or wanting to vote for more things. Does anybody have any particular feelings about that? No, I see head shaking no. Okay, great. So this is part 1 of a conversation that we will continue in our next session or sessions. And before I pass it back to Dave, I want to say thank you for participating in that activity. I've been wanting to use mural for something for quite some time. So thank you guys for that opportunity. And it's also helpful to the work that we're doing and strategizing how to move forward. Thank you, Amy. I wish I could take credit for it. I don't know why I'm saying thank you, but thank you. Did anybody have any thoughts or reactions to the exercises or discussions that we just had? You know, what does it leave you thinking about? Do you have any pointed questions? What are your reactions? How are we feeling?
I think that they're just, I enjoyed the activity. I think that there was just so many good ideas from the post-its that and a lot of options. So there's just a lot of work to be done, and there's a lot of ways that we can improve. And then looking at all of the different things, I was like, wow, yeah, all of these things are very relevant to our work and for the success of our participants.
I agree. It's exciting stuff. There's a lot of work to be done, but if we strategize and prioritize, we can make some good stuff happen, I believe. Any other reactions or thoughts or questions? I'm just so happy to hear that you enjoyed the activity and the tool. It was a very exciting moment for me.
Yeah, I don't want to speak before other people, so I'm holding back. But I will chime in after the pause. Just looking at these things, I agree, right? Like these are all things that as a coalition, stronger together, it's easier to tackle, address, dig into, plan for than one independent agency working on healthcare. I know some of you are really big and have big advocacy departments, PHI looking at you, and do some of this work. independently, but having a coalition of folks. And this, when we were building the Green Economy Network and did something similar to this, you'll see some of the things that have 2 votes and maybe 3 and 4 and 5. I didn't look through all of them yet. You'll see that they kind of can overlap or be paired together. And from this, Jobs First can take the next step of like turning these into network goals. And it's not that, you know, something only got 2 votes and it would be cut. It's more that we'll figure out how some of them weave together into a goal.
Thank you, Carrie. And I put it in chat to Nicole, but I attended, Carrie inspired me to attend 2 really awesome training sessions on murals. So if anybody wants like the link to get signed up for that webinar, I'll pass it along. It can do a lot of cool things more than just this voting. So I'd be happy to share.
Yeah.
Any other thoughts before I pass it on to Dave? Well, with that, thank you again for participating in my ranked choice voting session today. And I will pass it to Dave to talk about where we are now and what's to come.
Thank you, Megan. So at the beginning of today's meeting and of course previous meetings, we've talked about the Jobs First process, the 5 I's, what that means. We're currently in the investigation phase of I's, talking about asset infrastructure, and we're using asset in the broadest sense of the term. So some of that relates to data research that we've talked about, what data says about problems that exist generally, or more often specifically about healthcare, and what the partnership can solve together. So that means reviewing demographic information, economic information. Many of you, most of you have been in meetings that we've already had where we looked at the state of the New York City economy generally, the New York City healthcare economy specifically, seeing how New York City's healthcare economy compares to the state and national healthcare economy. Obviously larger in New York, but we saw some interesting trends, right? That even pre-pandemic, the number of people employed in healthcare was going down, even as the demand for jobs in healthcare in the city was going up. And of course, for anyone who didn't get to join those meetings, we have recordings and we have copies of the slides for all that to be reviewed. So beyond that, we're assessing programs, policies, public policy, private policy, resources of any kind that are available, whether they are directly part of healthcare or whether they are, say, general wraparound service programs. And of course, needs. We've been talking a lot about needs today, of what workers need to feel comfortable working in person in healthcare, or just wanting that to be a path for them. And we've been trying to identify issues that create the need for the network, and of course, how we solve those. So together we explore and define problems that are related to this, obtaining input on activities, trying to really understand the barriers that job seekers face, or if not barriers, what is keeping them from wanting to be in this space. And we talked about flexibility, we talked about concerns about getting sick, we talked about wages. So we want to drill down into each of those. And as I said, we want to understand the labor market better, right? In not just healthcare generally, but which specific subsectors and which specific occupations, what the supply looks like, labor supply looks like now, what it could change into, and especially on the demand side, want to know what the predictions are in specific occupations and specific subsectors. And as we review assets, we want to think about this in broad sense. What are the fiscal, political, social, legal, physical resources available to healthcare workforce developers, to healthcare employers, to people trying to enter the healthcare program, so that we can, without having to reinvent the wheel, make best use of available resources and really apply them to the work that we're doing and are trying to do. And of course, assessing just how those resources are being used now, both how we are using them as members of this network, how we could use them as members of this network, and how, with slight tweaks or slight changes to our approach, how we could use them more or better. So in terms of thinking about where we are now, that's a lot of both understanding all of these things I just mentioned, understanding what we have, could have, etc., and then thinking about, okay, what does that mean for us as a network? And it's a dynamic process, since it depends upon what you and your participant, or even your potential participants, are telling us and telling you, and what you're telling each other. So in the asset mapping portion of the process, it's key to understand the tools that exist already, and the ones that exist but aren't being used, or don't yet exist, but with the, for lack of a better term, with the assets that we already have, that we could create or finalize or tweak to make work for us. Whether, and this can be as simple as some digital tool like Mural, or something much more involved, like a workforce development program of near city or state. So to understand what we can achieve together, and over what timeline, and with what kind of work from whom, we're going to be creating and sending an asset survey to all of you to really try to get a sense of what are the assets and resources that you already know about, already use, know about, but don't use, and why not using those, whether it's that they don't apply or they just don't work for a certain reason. And as I said, this is the goal of trying to do this asset infrastructure mapping, is to consider everything that's potentially relevant. So if there's anything that you are thinking of and you're not sure whether this is a resource worth mentioning, or even whether this is a resource at all, always put in extra information, because we're really trying to understand anything that's possibly relevant. And this is both relevant and potentially usable, both in terms of what your programs already have now, and just anything that you're seeing. If there's a proposed piece of legislation or a recently passed piece of legislation that intersects with one of the programs they're doing, that's a good thing to mention, because I always like to presume that if there's one person in the group that doesn't know about it or has a question about something, other people in the group don't know about something or have a similar question. So we're going to get that to you, but for the moment, want to just take a pause, because it's said a lot, and see what questions, comments, thoughts have on this process, see if this all makes sense, see if something is confusing.
Can I chime in real quick? Carrie, would you mind moving back one slide? I just wanted to point out here in the investigate phase, the text you see in green is what we have already kind of done or are continuing to do actively, and the black text is what we're stepping into and kind of finishing out. However, the investigative phase, like Carrie and Dave have both mentioned, is kind of an ongoing thing. We always want to be abreast of data and programs and resources available, but that's kind of explaining the different colors you see there. I just wanted to make sure that we highlighted that. Sorry to steal the floor. If anybody has questions, I give it back to you all.
I'm going to presume that silence means people are thinking a lot, and I know it's sort of a broad cover-all of everything. So we will leave that there for now. As always, if people have any questions or suggestions later on in the meeting, don't want to be like, oh, I had this great key thought or key question, but missed the moment. So we can totally come back to that. So one of the things that I wanted to also cover today is what we do every time, talking about any updates or highlights that are relevant. And in the last meeting, we had a ton of exciting updates, highlights, news that was mentioned. So I wanted to recap some of that today before jumping into everything else, and so that we get a sense of cool things that are happening. And while I'm mentioning these, of course, if anyone from relevant group wants to jump in and add in more details or updates or corrections if I got something wrong, then please feel free. So in the last meeting, PHI was talking about a grant-funded policy opportunity that had been happening in multiple states. I think it was Michigan and North Carolina, don't quote me on this, but more importantly, that is going to relaunch in New York and other states this autumn. And PHI was talking also about how the demand for healthcare is high, but supply is not. So how we, again, what we talked about today, how we improve job quality, but also how we highlight the quality of jobs that already have good quality that people might not be aware of, whether it's a particular occupation or something else. So that was a key part. We were also seeing that there's feedback about 1199's involvement in the network. And I admit I do not know enough about 1199. We'd previously spoken about working with them or getting them more integrated. And we definitely want to hear more about with whom we should connect in there and how this applies to really building out the career pathways and not just the individual one-off job opportunities. We also have talked about, and I don't remember if this came up in the last meeting, we talked about NIOSH and who is connected to leadership there, how we can work with them. And we discussed what that means in terms of, again, really forming connections either within the network or having these external partnerships that we keep working with. And of course, on the last meeting, and I think the meeting before that, or 2 meetings ago, we had a lot of information about labor markets, real-time information on job demand. And I know there were a lot of questions there. So if there's anything there where people have new questions, new updates, I've seen like, oh, we were talking about this in terms of demand, this in terms of shortage. We can cover that today. I'm going to take a pause for a moment because I've just been saying lots and I know I can talk too much and then we might lose the thread. And this could be questions or comments or just, oh, this made me think of X.
Relating back to what Dave was talking about, we have spoken with people from 1199 previously, but we'd like to hear if anybody has a specific contact that you would recommend that might be a warm outreach for us to contact to invite to the network. Does anybody on the call have a good contact we could invite to this network session?
Is anyone working with 1199? We'll start there.
Yeah, good point.
So I'm trying to reach out to them. My question to you all is, we've been trying to establish a connection with them for quite some time. I haven't been as successful as I'd like to have been. Thankfully, we have a dotted line to them through our anchor employer partner, which is through Montefiore. So obviously, you know, all of our hires that get into Montefiore will get into 1199. When you say you reached out, did you reach out generally to 1199? Was it the TEC or which particular division in 1199 were you contacted?
So in the spirit of safe space right now, and some of them are people who made that recommendation. So we can check with them as well if there's a specific person that they're speaking with or recommend we speak with. But yeah, thanks for raising that, Daniel. And then what about at NIACH? Does anyone work with the New York Alliance for Careers in Healthcare? I think it was Jody at PHI who said she does. So I'll connect back with her, because it'd be good to hear, you know, what their priorities are too. I know part of what they do is organize around the hospitals and employer side of things. So we could find out what they're hearing. All right, and then Dave or Megan, sorry, I don't have the agenda open in front of me. I think we wanted to make some space for any general updates around your programming or funding that you're hearing. Is that right? Or did I mess up?
That's correct. If anybody has any updates to share out before we move to action items and closing, we would love to create space for you guys to share that if you have anything.
Has training started?
We're actually, we have a cohort that's going to be starting September 26th. I can share with everybody. I'm actually trying to pull it up now. My computer is super slow today. I'm trying to see if I can get the flyer to put it in the chat box. But if not, alternatively, I can send it to email. And the flyer will have like the QR code and anything necessary that you have participants that are interested. They can just click on the QR code and the link. It'll direct them to the information questionnaire, and then they'll get emails, prompts about next steps and what to do.
Great, thank you. Yeah, and Daniel, feel free to send that to Jobs First, and we could circulate the full contact list.
All right, awesome, thank you.
If you can't get it in chat now, but either way, we'll share it in follow up. And what else? Has training started at any other folks agencies for September? I know it's usually a big month where things kick off.
At St. Nick's next week for one of our programs, we're starting our HHA cohort. So they are going to begin with job readiness. Then they are going to go with one of our training providers to get credentials and certifications, then internship, then job. So that starts next week. I have not ever dropped a flyer in Zoom, so I don't know how.
Just to us, we'll take care. Yeah, everyone send us anything you want the group to know about. We'll make sure to disseminate it. There's a longer contact list of folks who couldn't make it today. We have partners at Gutman that are also starting some. For the first time, they're starting 2 certificate programs in healthcare. One is tech, really, but healthcare related tech. So it might be an interesting opportunity for any of your alumni that are looking for, you know, continued opportunities. And then many of you were not in the meeting where Memorial Sloan Kettering Cancer Center presented. They have lots of opportunities in healthcare, like I'm sure, you know, most of the employers you work with. But the exciting thing about Memorial Sloan Kettering Cancer Center, they're a partner of ours through the 110 Coalition, and all of the jobs that they post, the package inclusive of benefit, their jobs with benefits, and you know, good schedules, and with the benefits package, the total compensation is over $63,000 a year. So you might not have candidates right out of your training that are eligible, but you might. And you might have alumni that are looking for advancement opportunities, and they're really good ones. So we'll make sure that we circulate some information around that as well. And Memorial Sloan Kettering is actually looking for workforce development partners to do customized training for them, upskilling for them. I've had conversations with Larry at St. Nick's. Gutman is interested. Some of the other partners here, sorry, I'm blanking. I think Phipps also expressed some interest. So that's really a good opportunity as a network to explore, because they are expanding and have, I think they said like 5,000 jobs in the next year that fall into that category, across a range of job titles though. So we will make sure all of you re-see her presentation deck, so you could take a look at some of the job titles and consider, you know, how we can partner with them. And Dave, there was something in the news or legislation or something, I think, that you wanted to update folks on.
Yeah, I suppose it's not news per se at this point, because it's from April. Hold on, let me get to my link here. But for many years, I don't know how many years now, New York State has had a 30% earned income tax credit bonus, essentially, probably not the right term, over the federal amount, and New York City has had a 5% over the federal amount, so 35% total for New York City residents who qualify. And as part of the negotiations between Mayor Adams and Governor Hochul and the legislature earlier this year, New York City received permission to increase the EITC matching amount from 5% to 30%. Meaning a total of 60% EITC bonus for workers who qualify, which comes up to a pretty substantial amount. You can even just go in and pretend to be a worker and put in the numbers, but it comes out to, I think, for up to about 11% bonus for a sort of typical type worker. Obviously, it varies a lot depending on household size, income, number of children, so it depends. But it's, since we've been talking about wages and how to improve job quality, this is obviously an indirect wage bonus that increased significantly this year. I do not know, though, if this is scheduled to be whether this is passed so that it is fully permanent, or whether New York City will need permission from Albany to renew this in the future. But my understanding is that this has been approved indefinitely.
Thanks, Dave. Anything else before we move to closing our meeting out today? Awesome. So as always, big thank you for your participation and for being here. This was a great activity and discussion today. I really am excited for what's to come and what we can do together. Again, as always, please fill in the feedback form. Dave is going to drop that in the chat for us. We really want to hear from you, and what you include in this feedback form also helps us tailor our planning for the group's needs and the sessions moving forward. So it's really important for us to get that feedback. Dave just dropped that in the chat. So we will also send a summary and action steps after the session, along with some of the flyers and different things that we've discussed. I'll attach those too. Please remember to further review the process map and work plan and send us any questions you may have. Always invite somebody who should be included to the next meeting if you can think of anyone. We're also developing that asset mapping survey that Dave had mentioned, and so be on the lookout for that between this session and next. And our next session will be on October 20th, 2020. Why am I saying the year? At 10 o'clock a.m. I was reading the date. So with that, I want to invite any thoughts, questions, or suggestions before we move to close. And I want to say thank you again for your input and your contributions. I always get so excited to see this group. Anything else before we go?
I created a public folder for flyers and stuff. And Jonathan, yours is already in there, and we'll share the link in the follow-up email because I want you to focus on the feedback form link for now because we really appreciate your feedback. And as Megan said, we will take everything we heard from you today in both activities and compile it, reflect it back to you, make sure we've got it right, and ask for additional voting around goals. And I think Megan, you also mentioned we're developing an asset mapping survey that will get out to you. So thank you for your brains. And Megan, great job with our first mural activity.
Thank you. Thank you all for being my guinea pigs that you didn't know you were going to be. And Daniel, I don't know if it's me. I'm having trouble accessing.
Yeah, it's aside from the fact that I can't even get on, I'll have to resend it to you. I'm probably going to do it from my laptop.
Okay, just
Oh,
yeah, email it. We
yeah.
can include it. Okay.
Yeah, Daniel, send it as a PDF attachment and we'll put it in the shared folder.
That's exactly what I'm trying to do right now. So.
Okay. Whenever you can.